Yeah. Did something happen in your screen? I hope so. Maybe anyone can respond because I cannot see myself in my screen. I hope everything is good in your screen.
Yes, it is.
Okay, thank you very much. Okay, so maybe before we start our exam, maybe a little bit, maybe you have relaxed with my explanation today before we do the exam. So I will just give you an overview about the measure of association in pharmacoepidemiology because this is the continuation with our previous meeting with the frequency. So why we have to do the measure with association? Usually when we analyze our data using the frequency like incidence, prevalence, something like that, and then we further have the question which are the determinants of the health outcome. So if we have a lot of data, for example, like risk factor, a lot of variable in our data, then we would like to see which data or which variable will interfere our outcome. So usually it's continue with the searching of the determinants of a health outcome. So usually first we have the descriptive epidemiology to generate our hypothesis, and then we continue with the association between the health related exposure and outcome. For example, like when we see that the incidence of cancer, something like that, in women, in men, and then we stratified by age, and then we stratified by maybe the body mass index, something like that, or other variable factors. Then we have the some kind of overview or percentage. Then we would like to see which variable will affect the outcome or the disease. So as we know that there are several study types that include the analytical study, which is the cross-sectional surface, and then the cohort study, and then the intervention study, which is randomized control trial. All of this study and also one study case control study. All the study required usually some analytical data, which would like to see if the health outcomes is influenced by the exposure. We would like to see the degree of the influence of the exposure to the health outcomes. That's why we have to, this is some overview about the RCT and cohort. So usually within the population, we will sample the population, we give the treatment A and treatment B, and then we follow by the time, and then we see which one is have the incidence or health outcomes that we are interested in our study. This is a little bit different with the case control study. With the case control study, usually we only have the only one variable of outcome, and then we see if there is some exposure to the patients in the case and in the control study. So usually we have or enroll the cases, yeah, who already have the outcome, and we also have or enroll people with the controls, and then we see if there is some exposure in these people. This is quite different with the cohort study. So the measure of association usually is risk ratio and then the incidence rate ratio. For this analytical study, usually we would have the contingency tables. If you have many variables, then you must do a lot of contingency tables. But using the statistic, you don't have to do this. So this is to explain to you how they or how the statistic calculate the, for example, the incidence rate, the relative risk, But usually, if we have a lot of data, just use the statistic, and then they will give us the results of the study. But behind those calculation, actually, what this happens. So we usually have to describe the study in the contingency table like this. So we have the disease or not disease group, and then we have the exposed and unexposed group. And then we have the total here and the total in the column and in the row. So for example, like this, we have this is the example from the schools of freshman high school. None of them had respiratory disease at the time, so this is no respiratory disease. But a number of them had begun smoking. Number of them, so the people with the dot is smoking. And then when the cohort re-examined in 2018, so they follow several years, and then many of the subjects had developed respiratory disease. So some of them with the red, blue is shown to have the respiratory disease. So with this data, first you have to make the contingency table. So there are respiratory disease and non-respiratory disease in 2018. With the respiratory disease, how many people who exposed to smoker and how many people non-smoker. That's also in no respiratory disease who are smokers and who are non-smokers. You just counting them, and then we have our contingency table. And then we continue with the calculation. If you are willing to see the risk ratio, then in the example, the risk ratio is the cumulative incidence in the exposure and compared to the cumulative incidence in non-smokers. So for example, in our example, the cumulative incidence of respiratory disease in smoker was 9 per 10. Maybe we can go back to this. So the non-smoker, the respiratory disease in non-smoker is 9. And then in the risk, I don't know if this is correct or not. This is comparing with the 10. This is 9 non-smokers, and then yes, it should be 22. So the risk of the respiratory disease is 9. And while in non-smoker, the cumulative incidence risk was 7. This is the respiratory. I think something wrong with this one. Maybe we can see the cumulative incidence in the risk in the people with the exposure and comparing with the people with non-exposure. Usually the idea is like that. So the risk, the cumulative incidence in the smokers, and then the cumulative incidence in the non-smokers, and then we have the risk ratio, which is comparing both of them. So there are the calculation is 1.55. So the interpretation is smokers had 1.55 times the risk of respiratory disease compared to the non-smoker over 18 years period of observation. If we would like to see the risk difference, so we just subtract the risk. So the risk difference is 22 per 100 or 22%. The interpretation is among the smokers, there are 22 excess cases of the respiratory disease per 100 smokers during the 18 years of study. I'm just curious with the incidence of this one. Let's see if we could see. So the risk of the incidence of the respiratory disease in non-smoker is 9. Yeah, maybe I will clarify next regarding this calculation. Okay, let's continue to the incidence rate of ratio. This is the example of the incidence rate ratio. This is the association between the body mass index and the development of non-fatal myocardial infarction. So in this case, there is no myocardial, and then we have to, if we would like to see the incidence rate ratios, we have to see we have to calculate first the incidence rate. So in the group of BMI larger than 30, the incidence of MI is 85. The person years in this group is 99,000. So the incident risk per 100 patient years is you just uh, 85 per 99. So we have this one. And then the incidence rate ratio in this population is 3.7. If you incident risk ratio is comparing between the incident risk of the patient here by the reference. So the reference here is people with the BMI below 20. So this comparing this one. And then you have this incidence rate ratio. So the incident rate ratio, you have to choose which one is your reference. Usually the normal one. So below 20 is this one, 3.7. So the interpretation is the woman with BMI larger than 30 had 3.7 times the rate of having a non-fatal myocardial infarct compared to the woman with the BMI below 20. So you just, when interpret the data, you should explain your comparison. I mean, which one you compare, something like that. So it's a little bit explain which one you compare in your incidence rate ratio. So I think that's the all, because we have to do the exam today. So I don't have. I said to Francis that we can do the class before our exam, but it's not possible because, yeah, I know that maybe you all already have the schedule, so it's unfortunately, but I hope that can clarify some of the association. We can discuss further if you want during the maybe the class. You can just email me if you want. Okay, and then now we will jump to. Let me end this share screen first. Okay, so this is at 8. Yeah, that's what we would like to see to do. So 30 minutes is enough, I think. And then we will begin with the 8:15, something like that. I will try to see if I can distribute the file. Okay, I will try to upload. I don't think I can upload some file in our Google Meet. Then I will put in our Google Drive. Let me upload first. Okay, it's already uploaded. Then I will share the link. It's quite hard and everything else. Yeah. So everybody, let's wait a little bit. Okay, it's already sent to your in your comments. Is everybody can go to the message in the Google Meet, and then you see I posted a link for the Google Drive. This is also the link to upload your answer today. Uh, Everybody maybe could access this first. So anyone who cannot access the questions, please raise your hand, and then maybe I will try to solve it manually. But before that, I would like to share some uh, not regulation but some guidance of our exam today. Identify your name and your number. Please open your camera, and then please answer the question below. You can just answer in this file, and then please save the file using your name or indicate your name in the file. And then pins time, because in Indonesia it should be 10. So you have to submit your answer to the link, and then we will end our exam if all of you already submitted. If you are already submit and then you want to leave, it's optional. It's up to you. You just leave if you already submit the answer. So before we start our examination today, is there any question regarding the exam? If you have any question, I'm here. So you just can raise your hand and then open your mic and then ask what will to clarify in the exam. Okay. Okay. It's not yet, but I think it's better to start early, because this is the open book exam. You can utilize all everything you have, and also in the exam you have to be able to access the internet to see the article or something like that. If you are ready, please prepare yourself and then just do the exam carefully. Don't be rushed, and I just wait for you. Okay. Okay. If all the student already writing the answer, please open your camera.